Test your Fmge, previous year questions knowledge. Which structure is palpated here? Posterior tibial artery. Identify the arrow marked. Pons. Identify the arrow marked. Extensor, pollicis, longus. In fasting state, secretion of glucagon aims to produce glucose mainly by gluconeogenesis and glycogenolysis. Which of the following would inhibit complex 4 of electron transport chain? Cyanide. Patient presented to opt with tendon weakness, ataxia, and history of 1 episode of unconsciousness. What is the most likely vitamin deficiency that may have caused thiamine deficiency? A boy with black discoloration of eye, skin, and ear pinna. His urine also turned black at room temperature. Which of the following metabolite is most likely to be found in this patient's urine? Homogentisic acid. Middle-aged man, presented with hypercalcemia, features consistent with renal insufficiency. On CBC RBC count were severely decreased. On X-ray, multiple lytic lesions are seen. Comment on diagnosis. Multiple myeloma. What the change in efferent arteriolar resistance is with related to increase in osmotic pressure? Increases by 3 times. Child visited the hospital with her mother with complaints of severe fatigue, lethargy, pallor, and irritation. He is a known case of IDA. He is on oral iron supplements. After reviewing the child, doctors are planning to start with for iron supplementation. What test should be done next? Ferritin. Most abundant plasma protein? Albumin.
10-year-old child came to the clinic. Her mother gave the history of repeated blood transfusion over the past. She is presently worried about her son, as earlier he was maintaining good grades in class, but now from past few months his grades are deteriorating and he remains lethargic. His blood investigations shows crescent shape to be C. What should be the next step in management in this patient? Blood transfusion.
2-year-old multiple history of jaundice, mild H's, sclera. Gilbert syndrome. 10 years old child presented with lower abdominal pain, rashes over lower extremities knee to ankle, and pain in joints. Hennock-Schönlein purpura. Glioblastoma falls in which grade of WHO tumor classification? Grade 4. A female patient with history suggestive of liver disease. Hepatocytes showing ground glass appearance. Comment on the diagnosis. Hepatitis B. Most common lung cancer. Adenocarcinoma. Which organism cannot be grown on an artificial culture? A. S. aureus. B. M. tuberculosis. C. M. lepri. D. Strep. Pneumonia. C. M. lepri. Blood bag should be disposed in which category? Bag. A. Yellow. B. Blue. C. White. D. Red. Yellow bag. Patient is presented with unknown fungal infection. On H&E staining there is presence of sclerotic bodies having a muriform cell appearance. Which is the possible condition? Chromoblastomycosis. Which organism does not have cystic stage? A. Trichomonas. B. Encyclostoma duodenale. C. Giardia lambia. D. Entomoeba histolytica. Trichomonas. A patient comes to emergency with history of 4 drug abuse and developed infection. Which of the following is the most likely cause? A. Strep. Viridians. B. S. aureus. C. E. coli. D. Enterobacterium fecalis. S. aureus.
A known case of diabetic patient came to the hospital with pigmentation of skin over the arms. He also found out to be suffering from micronodular cirrhosis. On biopsy, iron deposits are seen. Comment on the diagnosis.
Hemochromatosis. Test not done during blood transfusion. A. HIV-1, 2, B. Hep B. C. Hep C. D. Hep A. D. Hep A. Middle-aged man on urine examination shows Benz-Jones proteins. On X-ray, multiple lytic lesions are seen. Which of the following is most expected in his urine? Kappa light chain. A 45-year-old male presents with splenomegaly and following CBC findings are as follows. TLC1, 20, 000 myeloblasts, promyelocytes, metamyelocytes equals 45% basophils to percent. Comment on diagnosis. AML. Bilateral ptosis of eyelid with diurnal variation and more symptomatic in evening. It improves on eyes pack test. Diagnosis. Myasthenia gravis. 2.5D transverse. Size correlation vertical was 2.5 and horizontal was 3.5. Prescription for the spectacles: A. 1.5 on 90, B. 1.5 on 180, C. 1.0 on 90, D. minus 1.0 on 90.
Plus 1.0 on 90. A girl was myopic and has problem in reading. She was using her sister's contact lens. Sharing of contact lens may lead to A. Candidiasis, B. Acanthamoeba, C. Viral infection, D. Damage of lens, B. Acanthamoeba. A young male with history of trauma to right eye with vegetative material. On examination of his cornea, satellite lesions and hypopyon was seen. What is the probable diagnosis? A. Fungal keratitis, B. Geographical ulcer, C. Acanthamoeba, D. Viral ulcer. Fungal keratitis.
Patient with episode of blunt trauma came with complaints of monocular diplopia. What can be the most probable diagnosis? A. Recette cataract, B. Iridodialysis, C. Retinal detachment, D. Corneal injury. Iridodialysis. A female came to OP with history of grittiness many years. Her Schirmer test value is 5 mm in both eyes. What should be given for her treatment? A. Lubricants, B. Antihistamic, C. Antibiotic drops, D. Wait and watch. Lubricants. Chalazion. A 3-year-old boy had frequent itching and redness in summers with thick ropey discharge from both eyes. What can be the diagnosis? A. Bulbar spring catarrh, B. Allergic reaction, C. Mucopurulent conjunctivitis, D. Viral keratitis.
A bulbar spring catarrh. A 20-year-old with sudden painful decrease in vision in right eye after trauma. His pupils show relative afferent pupillary defect. What could be the diagnosis? A. Optic neuritis, B. papilledema, C. Traumatic optic neuropathy, D. Glaucoma. Traumatic optic neuropathy.
Treatment for recurrent pterygium is A. Excision, B. Excision with conjunctival graft, C. Keratoplasty, D. Excision with autografting plus MMC,
D. Excision with autografting plus MMC.
Cohort.
As per NACU, if you are doing counselling and screening for TB in an HIV patient in ICTC clinic, level of prevention is A. Primary, B. Secondary, C. Primary, secondary, D. Tertiary.
Primary, secondary.
Vaccine given to baby at birth. A. BCG, IPV, Hep B, B. BCG, OPV, Hep B, C. BCG, OPV, MR, D. DPT, MR, Hep B.
At what time you can give first dose of Hep B vaccine to a neonate? A. At birth, B. 6 week, C. 2 month, D. 6 month. At birth.
In a measles epidemic, measles vaccine is given to a baby at 7 months of age. Next dose of measles vaccine is given at A. 9 months, B. Booster at 9 months, C. Booster at 1.5 years, D. At preschool age.
At 9 months. All healthcare providers are present in village except A. TBA, B. ASHA, C. A. D. N. DN.
30-year-old male member of family is presenting with complaints of diarrhea, edema, ascites. On investigation it came to know that mustard oil is the main item in grocery. What is the probable diagnosis? A. Epidemic dropsy. B. Endemic ascites. C. Aflatoxesis. D. Lathyrism. An epidemic dropsy.
As per WHO definition, maternal deaths are A. Antenatal 6 weeks postpartum. B. Antenatal 12 weeks postpartum. C. Delivery 2 weeks postpartum. D. During delivery.
A. Antenatal -6 weeks postpartum. People eating K-soridol for last 1 year in an area. To avoid epidemic of lathyrism, all are done except A. Toxin removal. B. Crop ban. C. DEC. D. Vit C.
C. DEC.
Trends of events of diarrhea epidemic happening currently in an area is represented by A. Line chart. B. Bar chart. C. Pie chart. D. Spot map.
Line chart.
Country is in which phase? A. High stationary. B. Low stationary. C. Decline. D. Late expansion.
C. Decline. Comparison of life expectancy between two countries is done by A. HDI. B. HPI. C. Daily. D. Cayley. ADIID. Person lost both of his hands in a machine for that he lost his job and unable to write and do his machine work. What is impairment here? A. Disability. B. Loss of both hands. C. Unemployed. D. No machine work.
Loss of both hands.
A P1L1 lady reported to clinic 6 weeks postpartum who does not want baby for next 3 years. Best contraceptive is A. OCP. B. Condom. C. Copper T. D. Progesterone only pills.
Copper T.